shall we get started then? Right, well, I'm here today to talk to you about teeth, as you've obviously realised, okay? Because this is a very important age that you're at now. Have any of you still got any baby teeth left? Or have most of you got all your adult teeth? Still got one or two baby ones, but not many. So this is it, guys. You're virtually adults now, and I've got to make sure that you're going in the right direction, that your diet's right, and that your oral hygiene's good, because you're not going to get another set of teeth. So that's why I've come in now. Lady Dentist I'm called, but you can call me Alison if you like. And what I do is I go around schools just giving young people of your age an idea of what can go wrong. So soon I'm going to show you some really gory pictures of tooth decay, yes? And we're going to talk about gum disease, and we're going to talk about oral hygiene. But I also do a bit of rap, okay? Haps, we're singing and rapping as the foot taps. LD's doing laps with the dental wraps and bridging those gaps while the patient naps. We're checking out the caps for a leak perhaps, and we're drilling, and Ali's doing laps with the dental wraps. My patients never quit, they know it won't hurt a bit. I say, listen to me sing, but is it gonna be a hit? I say, no more aching, quit quaking and shaking. This dental pain is a habit you're breaking. Dental floss while you listen to the boss. Hear me rap like crisscross, then you won't give a monkey's. And pull it, taut, glide, wiggle and slide. Back and forth, we're going deep inside. She's a zapper like Frank Tooth Decay. She zaps with the healing hand. She solves dental mishaps. There. So now you're getting a good look at kind of what I used to see in the surgery every day. And has anyone sort of experienced this kind of problem with their teeth as yet? I mean, a few of you probably have fillings in your back teeth, but you've not got to this. Now, yeah, the white stuff is temporary filling. Where you see all the white blobs is has anyone had that white stuff put in the teeth? At the back. It's got a really strong taste, but usually falls out after a while. You've probably had temporary fillings in your baby teeth, and we do that a lot, but they're only good as a sort of short-term measure for getting people out of pain. So if you do go to the dentist and you have a temporary filling, always remember to go back and have the permanent one put in, because the temporary one, it won't last. So, now, what's the difference between those two pictures? Anyone want to just make a comment about... We know it's both tooth decay, but what strikes you as the difference? Yes? Exactly. Top one's kind of yellow, isn't it? Top one's all yellow, and the decay is kind of like all over the place, whereas the bottom one, it's black. But it's all the top teeth, but not the bottom ones, isn't it? So very different there. And that's another thing to think about, girls. When you're older, dummies are fine when you have a baby. Nothing wrong with using a dummy, especially the orthodontic ones, but don't dip them in things like Ribena, because you'll end up with all the baby's top teeth will all go decayed from the sugar. As long as you don't dip them in anything sweet, dummies are fine. There's nothing wrong with using dummies. And that one there shows you another one where the top baby four teeth, see how lovely the rest of them look? Just those four top ones and a few around the back are starting to go. But you can see again, now that is a dummy situation. The dummy was dipped in something sweet, and eventually it rotted those four top teeth. Now, here's another abscess related to these bad teeth here. So here we've got like the lips and the cheeks and the big bag of pus there. So if you stuck a little needle or something into that little dental instrument, it would pour with pus. So an abscess is a bit like having a big spot inside your mouth. Has anyone had an abscess? The one on the left is to show how we treat a tooth when it has got an abscess, and we're going to try and save the tooth, because if it's a front tooth and it's a grown-up tooth, if any of you had an abscess now on your front tooth, we wouldn't want to pull your tooth out, would we? Because you're not going to grow another one. So we would try and save it. So we drill all the bad out, and we put instruments up the middle of the tooth and dig all the infection out down the centre of the root. Okay, so that's what it looks like when we're doing complex dental work to save teeth. And here we can see somebody's got the roots of the teeth and they're having screws put into every single root of the teeth here. These are the roots of the teeth. And these are false like screw attachments, and then the caps or crowns are put onto the screw attachment. So we can do some great things, but believe me, it's not as good as having your own teeth. So even if you don't like the colour of your teeth or you don't like the look of your teeth, it's always better to keep your own teeth. There's always things that can be done. They can be whitened, they can be veneered, they can be straightened. You don't want to end up with crowns and false teeth, because This kind of work, it's hours in the dental chair, it goes wrong every so often, and it costs a fortune as well. So, you know, you want to avoid that. Okay, so you've seen tooth decay close up now. You know what we mean now by bad tooth decay, okay? So how does it actually happen? Well, this is what a tooth actually looks like if you sort of sawed through the middle of it. So we're looking at a cross section through a tooth there. Yeah, and you can see that stuff that builds up on our teeth is called plaque, and you'll have heard that term before. And it sits on the tooth and it builds up mainly overnight, not so much in the day. Okay, and in that plaque live bacteria that live in our mouth. So the bacteria stick onto that plaque on our tooth. So if you've got plaque on your teeth, you've got bacteria on your teeth. Now, if you don't brush it all off, say you have cornflakes or something sweet for breakfast, okay? You've then got sugar in your mouth as well, okay? And that sugar that's in your saliva will be used by the bacteria in the plaque, and the bacteria will produce acid, and that's how you get a hole in your tooth. So it's the acid produced by the bacteria that causes that initial hole. The acid literally burns through the enamel of your teeth, and that's how it happens, and we call it acid attack, okay? So acid attack is the first stage of tooth decay, and that's how you end up with a hole in the enamel. When we take x-rays, we're looking for decay where we can't probe, because sometimes decay comes in through the side. And this spreading out inside the tooth happens in probably about 6 months. And that's why it's very important that you do go every 6 months, because you can develop a big cavity. If you don't go for a year, you can go from being perfect dentally fit, perfectly healthy teeth, to having a big hole in your tooth. It only takes about a year, so you need to go, I would say at your age, at least twice a year. So the abscess is underneath the tooth, and that's why you get this big swelling on the gum. So let's have a look at what abscesses look like when they get really big. Well, here's lots of tooth decay again, and that's showing you lots of little abscesses on the gum there, so it's swelling up. But that's what it looks like on the face. Can you see that big swelling under the chin there? So let's have a look at a few more. Big fat faces, yeah? And I used to see this regularly when I was working as a normal dentist. People come in who hadn't been to the dentist for a long time, in agony. And sometimes, you know, they were so poorly, one or two I've had to actually send down to A&E for an injection of antibiotics because they were in such pain, and they actually had a high temperature with it, and I was quite worried, so I thought I'd better send them down to A&E. People, does anyone know someone whose teeth look sort of all gungy like that, do you? Oh, it's horrible, isn't it? Oh, and are you like backing away? Yeah, okay. Yeah, it's horrible. I don't know how anyone could want to walk around like that. Okay, that's just right. It's not blood. Okay, it's red. Yeah, that's exactly what it is. Well done. It's disclosing stuff. Yeah, you can get blue ones, pink. For some reason, I thought this was a good picture because even though it's red, it does look like blood, doesn't it? But what do you notice about where is it's around the gum line? Yeah. So when you're brushing, think about the join between your gum and your teeth, because that is where you need to concentrate the brush most, because that is where the plaque builds up. You do need to do the biting surfaces as well, but think about around the gum line, because that's where a lot of people go wrong. And that's why we tend to try and encourage people to brush up and down or even round and round, but not that way, because it does lift the plaque out from the gum line better if you go up and down. And also it doesn't wear the teeth away, because if you go that way, you do tend to eventually wear your teeth flat, and you're not really removing the plaque very well either, so you end up with worn teeth and plaque between the teeth and around the gum. So try and, you know, sort of make yourself go that way, round and round and up and down. Okay, that's the stuff. If that plaque isn't there, you won't get tooth decay. But we've all got a bit of plaque on our teeth, somewhere at the back or in between the teeth. So if we all disclose now, we'd all have a little bit here and there. It's not as easy to get off as you might think. So think about the areas that you might not be doing very well, like the insides and under the tongue, because everybody tends to do the outsides well, but not the insides, okay?